Hey, this is Dr. Yates here in Chicago, one of my good friends, Carlos Valentin, who I think should be a model or an actor or something fancy. And don't you think so?
Hey, it's in the cards.
No, it's in the cards. Hopefully somebody out there will see, because I was just saying he has the right look. Everybody now, on TV, you just want to cross all boundaries because there's only one race in the world. It's the human race. It's not this or that or that. And he crosses all boundaries. So what we want to talk about today is his hair. And hair is important. And I met Carlos on a shoot for a commercial that we did, and I noticed his hair was thinning and his face looked so good. I said, hey, Carlos, we need to do a hair transplant on you. So you kind of took the leap. And were you thinking about having a hair transplant before we mentioned it?
I thought about it, but I was at that point in life where I said, if it falls, I'll just shave it off. And so I was giving up.
Had you ever shaved your hair off?
Yeah.
How did it look?
I got a lot of people asking me if I was in the military.
Okay.
So, I mean, I could pull it off, but it wasn't me.
You didn't feel like, when you walked around, like you had that swag?
No.
Okay. How do you feel now? I mean, do you feel better?
My confidence is a lot better.
Okay. That's good. Now look how he used to look before. Is this you before?
Yeah, unfortunately, yeah.
Yeah. So that's him before. And before pictures are important because you want to know where you come from. Let me get a comb too. Somebody can get me a comb because I want to comb through his hair, because it's always good to know, like styling is so important after you have a hair transplant, because we can never make your hair as thick as it was when you were 15. Styling products, combing the right way, having the right haircut. Like you can see, he has the sides shorter than the top. That makes the best transplant. A lot of guys come in, I don't care how good you do, they'll let the sides grow out like bozo and then the top looks like nothing. That doesn't work. That doesn't make you look good or make me look good, So the process he had, turn around, I just want to show you the back right quick. The back, he had FUE, he still keeps his back pretty short. He had like 2,000 grafts and it still looks good. You can turn around to the front. He has we redid the hairline, kind of built up the temples with 2,000 grafts. It's been 2 years. If you had any advice to guys, a lot of guys are scared, or they don't know about it, or they think it's plugs, or all kind of stuff. What would you say if you had to tell guys?
If I had to tell them, I'd tell them just give it a shot. I admit I was scared at the beginning just because I didn't know what was going to happen.
Right.
Said, hey, if you can save my hair, might as well do it.
Right. And you also said you didn't want that big line in the back of your head either.
Right. I didn't want that ugly looking scar, and there is no scar. So.
Right. And that's the thing. That ugly looking scar puts you in the transplant club. I don't care what you say, or if somebody says they can get 8,000 grafts. When you walk around with that big slash in the back of your head, everybody on the street knows you've had a hair transplant. If you want to advertise like that, that's okay, but you don't have to. So we had great results. He looks good. He's young. He's doing. Are you doing Rogaine or Propecia or anything like that?
I've been doing Rogaine.
You've been doing Rogaine because you always. It's like going to the gym. You can't get a six-pack without working out. To keep the rest of your hair, you have to do something else. And maybe in the future, we might do micropigmentation. We might do more hair on him. But it's a work in progress. And right now, I would say, you look great. You look awesome. I'm proud of how you've done it. I'm proud of what we've done. And I hope more guys will stop being scared. And I hope guys will stop sending people in and say, hey, I'm coming in and I have 8 guys watching me. That to me is the most ridiculous thing ever, because who's going to watch a guy get hair in a year and look so much better than you, and then you're going to come see us in a year and then 2 years grow hair? That makes no sense to me. So stop being a chicken. And all the other guys who don't even mention how many guys are watching you, because those guys are chicken and they're just going to be bald the rest of their life, and we'll just let them be bald. So, anything else? Is Carlos's thing on yet?
It should be coming up.
Usually we have like life-changing experiences. We have some patience, hopefully if it doesn't take more than 5 seconds, because everybody's attention span is very short, including myself. We'll see if he passes through there. But these are all kind of pictures of, patients that we have. And you have to show realistic results, because everything's supply and demand. You can't take a bald guy like Elmer Fudd and make him into Elvis. It's impossible. You got to think to yourself, where did you get the hair from? You get the hair from around here and move it up here. The hair from here doesn't grow back, people. You know, you get the hair, you take it from the backyard and move it to the front yard. So when you have a hair transplant, like Carlos doesn't have any more hair than he had when I met him that first day. If we count the hair, you have the same amount of hair. It's just positioned differently. We can't make hair. If we could make hair, people, you'd have unlimited hair. We could just go back here, take as much as we want, move it, and this hair would grow back. It does not grow back. So that's part of the skill to make sure that the back looks as good as the front. So this doesn't look like it's coming up to your pictures, but which is okay, but this is worth 1,000 words here. So this is Dr. Yates and Carlos in Chicago. So all guys and female patients too, stop being afraid of it. If you want to change yourself, just do it.
Let's see, maybe it's next. Yep,
Maybe
there he is.
it's-
There he is.
He kind of kept the diary of himself. You know, look at them all cool. I like that one. Oh, those are all cool.
There you go.
Then there's me, you know. So, there you go. See you next time. It's Dr. Yates.